Okay, okay. Not so many people here now. One, in fact. But, however, we will get on with it, and maybe some more people will come and join us later. Mohammed, now. Now, I didn't see the case notes. You didn't post them. However, really, the reader shouldn't have to refer to any case notes. The letter should be clear and plain. So I should be able to tell from this letter, I should be able to get all the information that I need. So one reason why I don't look at the case notes when I'm assessing, your writings is that I'm not supposed to. I don't have to. Your letter should be good enough that I know who you're talking about, what you want me to do, and you've included all the relevant information. So looking at case notes, it's irrelevant. So, R.E. Brendan, who? Who are you talking about? What's his full name? What's his age? However, right, I've no idea. So for somebody, presumably it's a male, but I've got no further information about this person, so that's not a very good start. I'm writing to request further assessment and management of Brendan, whose features are consistent with rheumatic fever. Okay, he's got rheumatic fever, but how old is he, etc.? No idea. Okay. Initially. Now, another thing, Brendan, you don't use first names unless you're talking about a child. If it's an adult, it's Mr. So-and-so or Mrs. or Ms., right? If it's a kid, you don't, if it's a kid, you use first names. Like if it's a baby, baby Joshua, or so. I don't know here if it's a kid or if it's an adult, so that's kind of confusing. Okay. Initially, he. Well, who is he? Now, again, if it's a adult, you should have put the title and family name. Initially, Mr. So-and-so presented to me on 14th of 1st, 2010, complaining fever, sore throat, and lethargy. Examination, right. We don't begin a sentence with a noun. These are not case notes. It's not a memo. It's not a CV, right? So his examination revealed enlarged tonsils and surgical, I suppose that's supposed to be lymph nodes and temperature 39.8. Therefore, he was commenced on penicillin and paracetamol. You mean you prescribed penicillin and paracetamol? However, on review, after 5 days, Brendan, whoever this person is, revisited me with worsening symptoms or complaining of worsening symptoms. Additionally, now, it's past perfect, revisited, it's in the past, so he had developed right knee joint pain, loss of appetite, and disturbed sleep. Hypertrophied tonsils and swollen right knee joint were noticed on examination. Upon examination, I found hypertrophied, blah, 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 blah. Was noticed on examination. Why is that? Is this supposed to be, I don't know if these are typos or what, but is this a separate sentence, in which case it's far too short and it should be part of the previous sentence. FBCEC, and again, don't use abbreviations. You're supposed to spell them out. I don't know if you can hear this. There's a pigeon in the tree outside of my office window. He's making a bit of a noise. Well, it seems to be quiet now, so we'll carry on. So anyway, abbreviations, don't use them, spell them out, okay? On review today, either his ECG or Mr. So-and-so's ECG indicated prolonged PR interval. So, right, you're supposed to make these grammatically complete sentences. Right, that's what you're supposed to do, grammatically complete. Additionally, ESAT and ASAT were elevated. So this looks more like case. This, you know, these are not grammatically complete sentences. This is an English test after all. That's what you're supposed to do. It's not supposed to look like notes. Grammatically complete sentences. In view of the above, I believe Brendan needs further assessment and management. I would appreciate your urgent attention to his condition. Okay, but you've not told me really what you want me to actually do. I mean, again, this is the only time where the case notes, where I would need to see the case notes to see what the task is precisely. Are you making a request for advice? Do you want them to take some kind of action? Because this is very general. So this is very vague. And I didn't check the word count, but I've got a feeling it might be a little bit low. 145, way too short, way too short. That's no good. 145 words. So there's a lot of information missing. Oops. Let me just readjust my microphone. Okay. There's lots of missing information here. It's far too short, and it's not clear as to who you're talking about or what you want me to do. So that needs a bit of attention. So now let's have a look at this next one. I'm writing to refer Joshua, a 2-month-old infant. Okay, that's better. So now I know who has symptoms suggestive of, you don't need that, symptoms suggestive of mild dehydration and constipation. Therefore, your further evaluation management will be required. Now, there's no need for this. Why didn't you simply say, I'm writing to request your further evaluation and management of Joshua, who has symptoms, etc. Joshua was delivered, right. Now, in terms of presentation, of layout, right, you need to introduce your paragraphs. It's supposed to be a letter, so you use some kind of marker or like phrase. In terms of his medical history, please note for your information, etc. You don't just drop in sentences without any explanation or link. This is for the overall flow of the letter. Okay. Joshua was, so I would have put, instead of dropping in that, I would have put something to introduce it first. Joshua was delivered vaginally without perinatal complications, because you've got two. Please note he is breastfed. We know he's a baby, just simply say that. Please note he's breastfed. Well, if he's 2 months old, I would have thought so, but anyway. And why should we note this? Now, we don't really need this because I remember the case notes quite well. Later on, you advise or you mentioned that you had told Mrs. Vance to express milk from one feed and put it back in the bottle and, you know, etc. So we know that she is breastfeeding Joshua. So you don't really need this here. Okay. During the 6-week baby check, everything was normal, apart from only one bowel act. Right. So for which her mother, his mother was concerned. Right. Word order. Okay. So the order of a sentence here. Now, it would have made more sense to put the mother's concern at the beginning of a sentence, right? So put the important information at the beginning of the sentence. So you've got everything was normal apart from only one bowel action. Apart from him only having one action for which his mother was concerned. So why, you know, the important part here is the mother is concerned about him only having one bowel action. So that should be at the beginning of the sentence. That's the important part of a sentence, yeah? So I would change this word order, change the word order, right? Put the important information at the beginning of a sentence. So, and then say, apart from this, everything else was normal, okay? So don't put that first, put that at the end, put the important stuff at the beginning. I advised her to try expressing milk for 1 feed a day, giving it in the bottles and clean water, and to So put a comma because this is something else. And 2, return for a review after 2 weeks. Okay. On 13th, 1st, Joshua still had hard stores every 3 days to be during feeding and sleeping. Therefore, if that's part of a sentence, why is that capitalized? A trial of course with express milk or expressed milk from 2 feeds a day. This is what you call a run-on sentence. What is this? Again, put some words. So therefore, give me the ball. So what's the subject here? What's the object? What's the main verb? I'm not sure what is going on here. Therefore, a trial of colloidal drops daily, along with expressed milk from 2 feeds a day, and giving it in a bottle. What? So who is performing what action? I've no idea. Well, obviously I do because I read the note. But this, from a grammatical sense, this makes no sense. It's nonsense. I have no idea what or who or whom is doing what to who. So therefore, a trial is recommended or was advised, or therefore I advised her to give or to take. So, so I have no idea what is going on there, and I'm not going to waste any more time on that. On today's visit, Joshua hadn't passed. What's this? Past? So what hadn't passed? Any bowel motion or motions? Because if it's an abstract noun, it's pluralized in the previous 5 days. He is refusing the feeds. So present continuous, what? He's refusing the feeds now in general, or he has been refusing feeds. Presumably he's not being fed in your office. So presumably that's in the past. Yesterday or the day before, Mrs. Vance has come in to see you today. So what she's talking about is in the past. Yeah. So that should be changed. He refused, right. So you probably use present perfect continuous. He has been refusing feeds or refusing his feeds. He vomited once. So that should be past tense. So that should be past tense. And no wet nap is what? And has produced, and has had, and has made. So we need a verb in there. Okay, on the examination, he's irritable and dehydrated. That is what? Associated with. So we need an auxiliary verb that is associated with mild generalized abdominal tenderness. Or get rid of that. Is irritable, mildly dehydrated, associated with. In view of the above, I believe Joshua's constipation might be associated. That is associated with refused feeding, with him refusing feeding. So why is this infinitive? Refuse feeding? Is this supposed to be like a noun? Is it a compound noun? Is it a noun phrase? With him refusing feeding? So that makes no sense either. Therefore, I recommend admission to the emergency department. Blah, 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 blah. Okay. So, emergency. Why, if it's so urgent, why don't you put that here in the introduction? If it's urgent, shouldn't it be here in the introduction? The new criteria of purpose coming in August wants you to be clear. What do you want? What's the purpose? So, I'm writing to refer, and then right at the end, can you have an emergency admission? Shouldn't that be right at the start? Yeah. Okay. Let's continue. See what else we've got. Right now, you don't need a period. Everybody will tell you E2, swoosh, etc. You don't need a period after your title. Liberian. Do you mean from Liberia, the country? Or do you mean librarian. And why have you put her age twice? Why have you put that twice? We don't really need it. And I'm not clear what this is. If she is from Liberia, a country in Africa, I'm not sure what relevance that would have, unless you mean to say that she can't speak English, therefore she needs an interpreter. But if she's been a patient of yours for 20 years, so is that supposed to be librarian? And if that is true, who gives a shit if she's a librarian or not? Not to mince words, but what does that have to do with what you want me as the reader to do? Okay. Whose features are suggestive the offer would be highly pivotal. And what's that supposed to mean? Pivotal. What do you mean? Vital, urgent? That's not the same word. That's not very good as a synonym. So I'm not sure what you want me to do. I'm reading this here and I've no idea what you want me to do. Have I got to read right down to the end to find out what it is you want me to do? You have to be clear. You are referring Miss Top for what? What is it? What is it that you want me to do? So my diagnosis would be pivotal. Pivotal in what? Okay. Miss Top has been a patient of mine for 20 years. Okay. Regarding her medical history, she has migraine, Raynaud syndrome. She takes over the counter medications, that these drugs are not effective anymore or are no longer effective. In addition, she has had depression since 7. Therefore, well, there's no therefore about it. Therefore means as a direct result or consequence. It's simply and. She has been commenced on citalopram. Now, if it's a proper name of medication, don't forget it should be capitalized. Okay. On today's visit, she put a name first. Miss Top came complaining of generalized fatigue, bone pain, and abdominal distress. She had joint pain associated with morning stiffness and cold intolerance in the feet and hands. On examination, there were joint tenderness and loss of balance. However, there was no joint. Well, the blood test results are unremarkable. What blood test? You've just dropped in this information. You never mentioned this. What blood tests? And why did she have them in 2014, 2017, and now? So I've no idea what you're talking about. So she's had some blood tests on 3 occasions for what? No idea. Kindly note. Why should I note it kindly? Can I not note it unkindly? Why am I noting it kindly? The lab results will be attached to this letter. Don't need that adverb. Based on the above what? I would be grateful if you evaluate her condition with further investigation. What if you would investigate her condition further? That's better. And treat as you feel appropriate. So I'm not really sure what is going on here. Not a lot of information here. 175, and that's with my comments. So it's a bit short anyway. Information missing, I think. I think you certainly could have put some more in there, because I'm not very clear what you want me to do. Okay, what's this next one? Right, again, you don't need the period. 76-year-old, well, okay, but we can see that. Widow, does it matter if she's a widow? It only matters if, if it affects a social or situation or something. If she doesn't have anybody to look after her, then, but apart from that, we don't really need that. Information was presenting with features suggestive of a recurrent. Well, right. Now, how is it a suggestive of? Now, either she has a venous ulcer in her right leg, or she doesn't. it's not, it's not suggestive of, is it? Either you can see on her leg she has an ulcer or she doesn't. Right now, you use this phrase with features suggestive of when you are not clear as to the diagnosis and when you are requesting a definitive diagnosis from whoever you are writing to. Yeah, you're not sure. It's a suggestive, indicative of something, and you want them to confirm it. But here, it's not suggestive. She either has an ulcer on a leg that you can see, or she does not. So we don't need that. Okay. Don't need that. I would be grateful if you could arrange for home visit, for a home visit if it's a singular, then twice a week. Why is that a separate sentence? No need for that. That should be part of the previous sentence. In order to manage and dress her wound. As for social medical history, Miss Sirocco, Ms. Sirocco, how do you spell that? Sirocco, lives with a daughter. Okay. She has had hypertension, for which she's been on bid bonus, which also has been occurring or recurring after skin graft. Well, it's usually on, it's not usually in. It's usually on, like in 2015. On the 17th, Mr. Sirocco was complaining of mild redness and swelling of her ulcer, but had healed just 3 weeks ago. Therefore, she was treated. How do you treat someone conservatively? How do you do that? So that adverb, we don't really need that. It doesn't make sense. With dressings and analgesics. 2 weeks later, she began to shop. Am I reading this correctly? Is there anything else that it could be? Despite the fact that her lesion had not been or was not completely a lesion. No, a lesion was not completely cured. Watch your adverbs and your verb order. But I'm not sure about this. Began to shop. I hope. I don't know if you mean that she is ambulating now, or she's been walking about, going to the shops. So that needs to be explained a little bit, I think. Miss Sirocco returned back. Well, she simply returned. Because ulcer, as her ulcer had deteriorated, increased swelling and redness, examination of the prone exudates. Thus, an antibiotic was prescribed. Thus, why is it passive? Didn't you prescribe it? The ulcer examination revealed a purulent exudate for which I prescribed antibiotics. Didn't you do it? Yeah, you were the author of the action. Should you have any queries, please don't hesitate to contact me. Thank you for your kind care. Kind care of who? You? Her? Okay, thus an antibiotic was described. You mean prescribed? Description just means, so let me see, it's a kind of medicine that cures this. It comes in a little box. That's a description. You mean prescribed? Prescription. Okay, that needs a bit of work, I think. Word count, probably not too bad. Let's have a look. 185, but some of those words are mine, so that's a little short, a little bit short. You could have put some more information in that to fill it out a little bit more. Right, I think I've got two. Let's see, I don't know how much time I've got. Might have time to do these last two. Okay. Let's have a look. Mrs. Carol Potter. We can, we can count, we can read. Suffering from worsening left knee pain for your further evaluation. Regarding Mrs. Potter's medical history, she is known to have, she has had osteoarthritis since 2008, mainly affecting her hands and knees. Put that adverb there. She is also known to, she has also had hypertension. It's well controlled, blah, 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 blah. Okay, Mrs. Potter presented, of course she came to your practice, where else? Presented by, with. You don't present by, you present with. Worsening left knee pain, presented with a worsening left knee pain, right. So what you need, word order, what you need. So Mrs. Potter presented with a left knee pain which had worsened over the previous year. Do it like that, okay? This pain became severe enough to occur even at rest after a long walk and is no longer controlled by regular Panadol osteo. You could put that in a single sentence. Mrs. Potter presented complaining of left knee pain which had worsened over the previous year and which occurred at rest and is no longer controlled by blah blah blah. On examination, there was limitation A, a limitation of, or limitations to her left knee mobility due to pain or due to the pain. Also, what is that? Very short sentence, that should be part of the previous one. Were ordered and prescribed. Did you order? Did you prescribe? Why is it a short sentence? Why is it passive? You could put all this into a single sentence, make it active. On examination, I noticed a limitation in her left knee mobility along with joint tenderness, so I therefore ordered x-ray and blood test and prescribed blah blah blah. Okay. On the next day, the x-ray or her x-ray revealed evidence of severe left knee osteoarthritis together with joint space loss and osteophytes. I requested a physiotherapy consultation and built up analgesia for better pain control. This reason you're focusing on highly oh, really? My favorite phrase, highly appreciated for possible knee joint replacement. Okay. So I would have put, so I'm sorry, I don't know if you can hear these church bells, but 9:30, everybody's going to mass Sunday morning. Oh, they've stopped now. Okay, good. So for the case notes, I think you're supposed to be assessing her for the possibility of a total left knee replacement, I think. So you should mention this in the reason for writing. Now, you say for your further evaluation, but evaluation concerning what? The possible left knee replacement. So I would have mentioned that in the introduction. Okay, the last one. I'm trying to avoid repeat offenders, but there was only 4 or 5 new letters this morning, so I'll take a look at this one. Mr. David Taylor, I'm ready to request knee surgery for Mr. Taylor. Whose signs and symptoms are indicative of knee cartilage or any cartilage injury. I would be grateful. Now, you see, that's not bad, right? I'm writing to request, I want you to do this, I want you to take this action. That's pretty good. That's what we want. Regarding his medical history, now, I wouldn't usually put the occupation in, but this has a direct relevance and pertinence because I remember from the case notes, he's concerned about being unable to work. due to his condition. So therefore, mentioning his occupation is relevant and pertinent in this case. However, I see quite a lot of people saying they are a retired administrative assistant, which has no pertinence to anything, or she is a university student, etc. Again, which has no relevance or pertinence. But this particular letter, and this is why I keep saying, you need to treat every letter as an individual, because that's what OET do, because they know that you keep using the same phrases and you have like a template and all this, So every letter is different and should be treated as such. So the occupation here needs to be included. Complained about, you don't complain from, about having knee joint pain and swelling following a twisting injury several minutes ago, which was managed with simple painkillers. 6.5 injury, he had experienced difficulty. He was experiencing past continuous difficulty in strengthening. I'm not sure if it's strengthening or straightening. I can't remember, but in any case, it wants to be a present participle. He was experiencing difficulty in strengthening his leg, and his work productivity decreased or had decreased. Get your word order right. So this is why the landscape gardener part is relevant. On the examination, management was 1, 2 were observed. Who observed it? You. Therefore, Voltering was commenced and he was advised to be reviewed again. Well, he was advised. I advise you to come back and have a review. Would you really say that? You would arrange. You would simply say to him, okay, Mr. Taylor, I'll see you in 2 weeks' time. You wouldn't advise him to come back. You would tell him to come back. 2 weeks later, Mr. Taylor attended or re-presented as his condition had deteriorated with increased pain because that resulted in a decrease in his income. His examination showed impaired power range along the same period of time, therefore an singular countable MRI was arranged and advice was given regarding his condition. Advice was given. What's all this? What's all this passive? I arranged. I advised him. Was given regarding his condition. Beside what? Beside an appointment. Right. This is one example where passive it doesn't work. Right. Active would make this a much better sentence. Therefore, I arranged for an MRI. And advised him regarding his condition, and I also made a review appointment for 1 week's time. That would work better in active. Not every use of passive works. It can make things more lengthy and complicated. Today, Mr. Taylor, and again, we don't need that period, returned back for MRI results. Well, and so we either need an article or a pronoun to make it grammatically complete sentence. So for his MRI result, or the MRI result, which revealed medial knee cartilage damage. Apart from a slight decrease in pain intensity, Mr. Taylor is anxious and desperate. The symptoms have not improved. And he does not work, or he cannot work. Not he doesn't work. He cannot work effectively. He's prevented from doing so. Based on the above, I'm referring Mr. Taylor to your care, urgent for management to his knee. Okay, so that's the last for today. Just about. I've got 6 minutes left, so that's not bad. So, okay, I'm gonna throw it open to questions now. You've got 6 minutes, 5 minutes. Any questions you can ask, you can type, or you can raise your hand and I'll turn your microphone on. So, right. Hello, hello. Your microphone's turned on. Is it Brenuma? Hang on. Don't do anything. Let me unmute your microphone. I did. Right. Your microphone's on.
Hello.
Hello, hello. Can you hear us?
Yeah. Yeah. Good evening, sir. Thank you.
Good morning, in fact, here in Central Europe.
Yeah, but in Bangladesh it's afternoon. So thank you for evaluating my letter. I have a question regarding a word, suffering.
Mm-hmm.
In official OET live videos, they keep on saying that we should avoid using suffering. So in your letters, which you have evaluated, you haven't said anything about the word suffering, and people are using suffering and also
I don't really know why OET don't think that. I mean, it's a perfectly acceptable verb. You are suffering. If you are in pain, or if a patient is in pain, he or she is suffering.
Yeah, I also think that.
Well, okay. Too. If you don't like it, if you don't want to use it, if that's what they had advised, then okay, use complaining of.
Okay.
The patient is complaining of pain, complaining of having pain instead of suffering. I don't see why OET should actually make such a distinction, because it's an English test after all, and it's a perfectly good verb.
Yes, sir. But I had a question regarding the chronic condition.
Mm-hmm.
Can we use that she has diabetes for 10 years?
Well, she has had. Present perfect.
Yeah. Okay. So we have to use has perfect. Had.
Well, right. If you're talking about a period of time using the adverbs for or since, you can either use present perfect continuous or present perfect. So, for example, I have been living in Bratislava since 2016. I have lived in Bratislava since 2016. So either one of those two, using either for or since to describe the period of time.
Okay. So in that case, I would write that she has had diabetes for 10 years, right?
Yeah, because it's not finished.
Okay.
Yeah? Or you could, she has, well, maybe not suffering, but she has had, because it's not finished yet. I mean, one light use of present perfect is to connect past and present. So I would use it,
Yeah. Okay, I can get it. Sir, I have another question regarding the introduction. I keep on writing, thank you for saying Mr. Blah, blah, blah. So are you saying that if I write that I am writing to refer, it is better than the thank you for seeing?
The new criteria, and you can find this on, there's been a blog post by E2, Swoosh, and Benchmark. The new criteria beginning in August has a category, that of purpose, and they have made it clear that you have to be clear right from the opening what it is you want the reader to do. That's what they've said. It's purpose. That's the new one. They've changed a couple of things, but that's the most important one. They've all said, say it's on E2, Swoosh, and Benchmark, they've all said that what the OET want now, they want it crystal clear from the opening what it is, your reason for writing. I am writing to request that you do this. I'm writing for your advice I'm writing to request a diagnosis, etc. Okay, so that's what you got to do. So so if you think about that, and every letter, as I mentioned today, is different purposely now, because they know people are sharing these phrases and templates, and that's not a good idea. So all that you have to do is think, if you were the reader, what would you want? You would want it clear. Oh, I'm writing to refer who for what? what is it that you want me to do? And that should inform you as to what you need. Okay. Now, we're going to run out of time in a second. It's only 40 minutes and it's going to suddenly stop. There's less than a minute. So I'll be on Telegram for a while, and I'll put this recording on YouTube because this is going to run out in a couple of seconds. It's only 40 minutes. It's the free version because I'm not paying $14 a month for the Pro. So I'll see you in Telegram.